I'm Wendy Herzog, science and peptide enthusiast. In this episode of Exploration Science, I met up with Dr. Meritxell Teixido. She is the founder, the CEO, and the CSO of Gate2Brain, a company devoted to breaking barriers. So thank you for doing it, because I appreciate your time. Cool. I know you're busy.
I love doing very, very different things, and yes, and they range in science, but they range in many, many other scenarios. So I love traveling. You can see here. Yeah. I love traveling. In fact, this summer I will travel to Thailand with my kids, so it's great. But also I love singing.
Oh.
I study chemistry. I have a major in chemistry. I decided to go for organic chemistry and peptide science, but then I decided to study scientific diplomacy, which is not the use of science for going beyond science and using it as a tool for diplomacy between the countries, which nowadays would be a really important tool sometimes. But so I studied this some years ago, and yes, so I love doing very different things, which is part. I think it's part of the fun. Let's put it like this.
Absolutely. In fact, I saw that you did a TED Talk. So TED Talks has a Stieg. Is it Stieg? Is that how you say the city?
What?
The city Stieg? Is it Stieg? It's like TED Talks. Stieg? I don't know. I'm so horrible. Stieg? Where's the EPS? Where's the EPS?
Sitges. Yeah, it's in Sitges. Yes. So TED Talks are in Europe, and then in Barcelona there are not TED Talk serials, but they have started in Sitges, which is a lovely place, 20 kilometers south from Barcelona, and it's a small town that it's very well known. Not for peptide science in September, yes, but it's very well known for a cinema festival, like Cannes or this kind of festival.
Really? Okay.
For terror films, but so it's really, really an important place for terror films. And then they have a very big auditorium, and they are starting to do the TED Talks, and they invite me to give a talk at the first serial of TED Talks. And it was fun.
Yeah, I mean, but so the talk was about empathy.
The talk was
right?
leaders. We are all 3D leaders, and we need to leaders. Well, I believe in the leadership based in empathy. I think the old school of leadership probably is changing, and all of us are different. And I think that the pandemic has accelerated many years of this kind of type of different leaderships. And I like it, and probably that's why I study scientific diplomacy. Is that I like creating teams focused in objectives and challenges, and that can be a big out of the comfort area, but that everyone puts their best to find a solution. And probably that's why I also take the jump to entrepreneurship, because in fact it's like a journey.
Yeah.
For example, the team, and it's a journey of leadership of a team, because the team is in Barcelona, in Madrid, and Tel Aviv, and then you have to do that sometimes by Zoom, sometimes presentially, and I think being a leader, and we always talk about, okay, the teams need to be very different, people need to be very different, but very different is very, very different, and it doesn't only mean cultures or religions. I believe a lot in the inclusion of people with diversity, with disability, because it's when you will find very different solutions, which us the perfects. I call us the perfects, and I can say that in this way because I'm the mom of a special. I'm the special mom of a special kid, I always say. And the solutions that Mark has found for the everyday are very different, which I cannot reproduce. No, but if they work, are great.
Yeah.
So I think that the teams need to include all the range of ways of thinking, and then it's when the solutions are there.
Absolutely. I couldn't agree more. And, actually, when I was looking at Gate2Brain, even before I came across your TED Talk video, it did come across as almost a mission of empathy to provide medicines. And so maybe can you talk a little bit about the company itself, technology, your thoughts around
and what is behind there.
Yeah.
No, in fact, it's called Gate2Brain, and it has like a title underneath, that says Medicines Beyond Barriers. When you say that, and if you know my background, you say, oh yes, it's the biological barriers, the blood-brain barrier. It's true, it's medicines beyond the biological barriers, like getting the drugs to the brain, blah, 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 blah. But there are a lot of barriers, like the barrier of finding investment in pediatrics, and we are trying to be part of a movement, especially in the States, is starting that it's called Kids First, or Pediatrics First, because the drugs need to be developed for children, not for an adult, and then you just take part of the drug for a kid. It's not a recalculation of kilos or pounds of a kid. So you need to develop it for them. And if it's this the case, you need to make that investors want to invest in pediatrics, which sometimes is something they run away. So there are barriers of investment, and we always say this, in fact, is the barriers that we think that the health should be for everyone everywhere.
Yes. And
for this, you need to make that your solution can be applied everywhere, and not only scientifically, but it can be applied everywhere. So yes, it's not the typical mission values of your company, but it takes a while to think about it, and in fact, it's one of our strengths, is why we do it. Yes. Why we do it.
Yeah. I think, and I want to dive deeper into that, but I do think just it's important to point out what you just said was that your company, the flagship product is for pediatric oncology in a rare disease area.
Yeah, which is like you are there. That's completely after. So I was 15 years at IRB, for research in biomedicine here in Barcelona, responsible for a research line that leads to Gate2Brain technology, that are these peptides that are able to go from the blood to the brain and carry drugs that cannot reach the brain alone. Great. I always say that there are cars and caravans, so I have a car factory, a car dealer. So cars that go to the brain and bring caravans. So you can apply to many diseases, where there's a drug candidate that needs an improvement of transport. But we decided that the first indication will be in pediatric oncology, for different reasons. But one of the reasons also was that here in Barcelona, there's one pediatric hospital that it's Sant Joan de Déu, that it's one of the best and biggest pediatric hospitals in Europe. But it also covers this mission of for everyone everywhere, because the kids from all around the world travel to Barcelona to get treated. In Spain, the health system is public and is free. So this is part of the health for everyone everywhere. And we decided to focus on that, which is hard sometimes, but it's also a lovely journey.
Yes, absolutely. I think, like you said, there's so many things that are difficult about it. It's even like wanting to learn about the disease itself, to click on it and then start reading about children. It's just, that's difficult. And then there's so many barriers, like you mentioned, of investors designing clinical trials, understanding that, like you said, the pediatric population, they're not just like quarter-size adults. They actually have their own physiological differences.
Completely physiological difference. Yeah. And also, there were a lot of decisions under that. Mm-hmm. So it means, for example, we decided as a company that we will not get funded by families of affected kids. That's a red line. Okay. No, one thing is a family office. That's another thing. It's a big family that wants to invest and then invest in this is one thing, but not family, because I'm sure we will try our best, but even that, it's 10 years or 5 years or 8 years away from now, and it's risk. It's always a risk. So we don't find it fair for that. And in fact, the website, it's very driven to the technology, not to the indications, because we are dealing with indications that the expectancy life after diagnosis is between 8 to 10 months. Under that scenario, you need to be very elegant as a company.
Well, and I guess that's also another point, is that it is a technology platform. And I remember in 2007, my first APS, you did a flash talk, and you won the Young Investigator Flash Talk, talking about blood-brain barrier. And
in fact, I win. I think I'm the only one. I'm the American Peptide Idol, which is great for a person from Barcelona. It's
that's
great, the American Peptide Idol. I remember I was a PhD student there. Yeah, I finished my PhD there. And I present my poster, and my PhD advisor, Fernando Alvericio, said, present yourself to this competition. I was like, yes, Fernando, but it's the American Peptide Symposium. I will not win. So I presented. And then I presented, and then it was like the American Idol contest. So there was the judges and everyone voting, and it was fun. And I remember then in the gala dinner that I don't remember the name, but he remembers my name forever, because he was like, and the winner is, and he opens the envelope and then he cannot, he cannot pronounce the name and says, no, Mary something, Mary something. And I remember saying, you have win. I was like, no, there's no. I said, yes, just look at the face and you will see you have win. But it was fun. And in fact, I take the prize and decide to spend some time in Australia. So it was a way to see another ecosystem of science, and also enjoying traveling to Australia. It's really nice.
Yes.
But yes. So I have been involved in peptides for a long, and I think it's a community of the right size. No, because if you are cardiologists around the world, there are thousands. It's a huge community of medical doctors. Peptide science is. Anyone that describes himself as a peptide scientist is not so big.
Absolutely, yeah.
It's not so big.
Talk to me about your transition. When did you decide actually to start Gate2Brain? So, because you were at IRB for 15 years?
15 years in a permanent position. So that's a barrier. That's jumping a barrier. So So when I was at IRB, I was really happy. Co-directing the 10 PhD students, I was really happy. We had a lot of articles, 3 patents, great. But I was like, yes, but I want to see the entire journey. I want to see the entire journey. So if this works well, how will it end up? So for that's a big decision. And it took me like 4 or 5 years to organize everything. Organize everything means, because I wanted to live this experience as in person. So I have to prepare myself doing an MBA, and then finding the right team, because the team is not from IRB. So I don't take that team and transform it to Gate2Brain. No, I learned when I closed down that lab, not one day, but at one point, I did not take more PhD students. I take post, like you close that lab, and then I create Gate2Brain, and I make that transition. The only thing that was not planned is to do that in July 2020, in the middle of the pandemic. It was a bit crazy, but it was fun. So then I start to apply for grants that were specific for that, for when you need to do some experimentals in your technology that are not fancy enough to be an article, but are the ones that you need for an investor to put the money on that. It's a different kind of experiment. So a scale up these things. Yeah. Okay, I will not publish yes, but you will not publish a scale up, and sometimes it's a bit outside of the academic objectives. No, so I started to do that, and then I applied for a program that is called Mind the Gap from Fundación Botín. Fundación Botín is one foundation from one of the biggest banks in Europe. I applied in 2018, yes, and there were 400 projects, and we were going through phases and phases and phases and phases and phases. And then the pandemic came, and we keep going by phases and phases and phases until we were selected together with another. So they only invest in 2 every 2-3 years. So wow, and then we received the news, and we were like, okay, well done, perfect. And we decided to keep going and close the lab in September. Also, we make this calendar together because Professor Ernest Giel was retiring. So, okay, we make just the right time for that change, helping the people to go to the next stages, the people in the lab. It's not mandatory, but it's something that...
right thing to do.
Yeah, it's fair. So they have jumped to different places in the world, which has been nice. And then creating a new team, which I love it. This team it's in Barcelona. Well, we are 4 founders. And also the team is in Barcelona, in Tel Aviv, here. We are producing it in India and doing the experiments here in Barcelona, in Germany, in Portugal, like everywhere. And for this, the pandemic has helped us because, okay, we were at this bit of a fluid company, which would have seemed very strange before the pandemic. Right. But then people find it normal.
Mm-hmm.
Find it, no, it was a team of people that has a common goal, a common challenge, and some of them are part-time, but people that wanted to enroll this journey or this adventure of advancing the use of our technology in pediatric oncology. This was the aim or the common goal. Let's put it like this. Yeah. And what else I have done that? Well, I was organizing so I don't know how long I have been organizing the European Peptide Symposium. I think it, yes.
Oh, yeah.
I think I check it these days because I applied for that, I think like 10 years ago. So I cannot even imagine that I will be here. So then it was planned for September 2020, but obviously we decided to postpone it, and we will do this next September. And we also find like the lemma or the sentence from a meeting that is from peptides to the wall, which every day is taking more sense, I would say, no? So because it's a small big family from all around the world, and I think it will be a very great reunion. I'm also coming to the one in Whistler.
Yes.
I think and I think it's necessary. So everything has gone very well online.
Yeah.
But there's a missing ingredient.
I agree. There's so much we can do. I think like even just being able to engage more diversity, it's, sort of to your point, and the fluidity of now how people react when you reach out. Hey, would you like to talk to me? And people are like, yes, I would like to talk to you. Like there's not this weird barrier. They're like, no, it's totally fine. I can jump on a Zoom call. I remember actually very, very close to the start of the pandemic, Christina Schroeder was in Australia still, because now she's in the US, but she was in Australia, and she was like, let's Zoom, because she and I needed to talk about the GRC. And I was like, what is this Zoom thing? And then it became like my whole life,
I remember at the beginning, when we were in the company, at the beginning we were trying different, not only Zoom, let's try the other options that are appearing. Some of them were so weird, and then strange people appear on our Zoom. It's like, oh, but we are 5 and we are only 4. Who else is here? So the confidentiality was really bad until we managed to organize it in a proper manner. But it's a while. We have adapted very fast, I would say, in general. But.
Yeah. So I did I meandered around a question. I was asking you about the technology because I think it was a good point that you have a platform, and yes, you've chosen this one indication to start, but that it's useful for delivering a variety of molecules. Can you just describe the platform and also where you think it's going to be going?
Mm-hmm. Yes. So what is the platform of Gate2Brain? So Gate2Brain is a platform technology that has 3 families of peptides. All of them come from chemistry, so it's chemically produced. And these 3 families have the ability to cross barriers. Are peptides that range from 9 to 15 amino acids. And the common hallmark is that all of them are protease resistant. Why they are protease resistant in each family is different. So in some cases, because they are inspired in peptides in nature. Nature has done part of the job. Sometimes we are using the amino acids. Great chemists have done part of the job. So different approaches. But one of the potential is having this platform means that we are able and have proved during these years, and the 10 PhD students and a lot of work of the team, we have proved that these peptides are able to transport across the BBB molecules of different natures. So ranging from peptides, proteins, nanoparticles. So we have proved different things, small molecules, that we were able to improve the transport. But were things that were not therapeutically useful. I mean, I'll put an example. We have the Angevanten. We have published that thanks to the shuttles, we can transport quantum dots to the brain parenchyma. But up to my knowledge, nobody has been cured by a quantum dot. But it was a great tool to prove that. So it's when we decided, okay, let's choose a first indication, and we choose pediatric oncology, which in this case is a small molecule, but it's what, okay, now we go for an indication. Obviously, after that, we are looking for a couple of big pharmas to work with their candidates, because even if we make this work, which is lovely for our in-house product, they will say, oh, it's great, but do you know if it works with my candidate? So this will be the first question on the row. So this is the stage where we are looking for a co-development that doesn't need to be in small molecules and doesn't need to be in pediatric or in oncology. only is a candidate that needs a better transport.
Yeah, this could be an oligonucleotide therapeutic. It could be a peptide therapeutic. It could be a small molecule. There's not a barrier to what you could.
Yes, probably during these years, the BBB it's complex. And I remember that some years ago, people was claiming, "Oh, you don't need to care because it's always compromised."
Right.
It's probably true, and that at the final stages of some diseases, the BBB is compromised, because at the final stages of some diseases, almost everything is well compromised. But we are learning now, all the society community, we are learning that some diseases we need to act earlier. And when you are starting to decide that you want to act earlier, you need to improve the transport of the drugs, because if not, the BBB is not compromised at all.
And actually, I maybe spoke a little bit hastily. Are there limitations actually of what you can transport? As far as like size of molecules or type of molecules?
Yes, it doesn't matter. Size doesn't matter. So one important thing, and is in this direction, is that our peptides use the natural transport mechanisms without affecting the normal function. Mm-hmm. Mm-hmm. We are not opening the BBB, which is another approach. It's great, but it's another approach. So we are using the natural transport mechanisms, also not competing with the natural ligand. Because if we modify the natural balance of transferrin, it will be a crazy, or of insulin, it will be crazy idea. So we are squeezing through the same transport mechanisms without affecting the native. Having said that, we have not found problems of size. Okay, gold nanoparticles that we were using is around 12 nanometers, and we did not have problems. This doesn't mean. One thing is that for each cargo, you need to fine-tune, for example, the number of copies of shuttle for that protein. So you need to fine-tune things, but not especially the size as a problem, more like the number, where you position it, the shuttles, these things, yes. Okay, more than not really the size of the cargo.
That makes sense. So you said sort of in the phase now that you're in is really trying to find partners, industry partners, that they can come to you and say, hey, we've got this molecule, we got to get it in the brain. And then you can start this process. And so this is... Yeah.
We are not a service company. So the final goal, in fact, is proving. So if we really want to go beyond barriers and have a huge impact, we cannot be a service company. Mm-hmm. Okay. So what we need to have is a very strong proof of concept that's the one we are doing in pediatric, and a couple of co-developments with impactful partners, Novartis, Lilly, or Johnson & Johnson, Otsuka, whatever, that trigger that one day someone acquires the technology. And then is where the big impact, not for those candidates, but also for all the pharma treatments, no? Maybe not only to send more compound to the brain. Sometimes it will be that you will need to give less to have the same effect, and then maybe you have less side effects.
Sure.
It's to change a bit the paradigm of the CNS diseases.
Yeah, no, that makes sense. That it's not necessarily just getting something across the brain, but targeting specific amounts across the brain to decrease toxicity. And yeah, absolutely. So, you have sort of these now perspectives from a CEO, CSO. Position, right? And I can hear that when you say we need to be this type of company to achieve these goals. How was that transition? Really sort of learning to be a CEO. What was this like?
You learn by doing. No, I'm joking.
Yeah.
It's thing that you learn by doing. Yeah. No, it was part of these 5 years. Okay, so here at this in Barcelona, you can find many projects or grants or programs that help scientists. The ones that decide to make this change, whatever we want to say, no, that doesn't need to be all of them. Maybe others prefer to license the technology and not be part of that adventure. Mm-hmm. But if you decide that you want to keep going with your product, there are some grants that you can apply that they give you some money, but especially they give you a lot of training to do that transition. And I was part of that.
Excellent. There's more and more. Oh, sorry, go ahead.
Jojo.
Oh, I was just going to say that I think more and more as we're getting out back into conferences and whatnot, I'm also seeing organizations like the Boulder Peptide Symposium putting together entrepreneur workshops, because we do have a lot of, entrepreneurs that are coming into peptide, right? I mean, you've got Caliber Sciences that the CEO is Ava Liss. You have RLS Bio, the CEO there is Christina Boval. We've got a Natural Products, with Josh Shoshwart and Cameron Pye. I mean, all these young folks that have come and I shouldn't even say young, just peptide folks that have come and started their own companies. And I think we're seeing that more at conferences. Even the APS will have an entrepreneur workshop. So I'm really excited for that. Yeah.
Yes, because I think that before, it looks like if you move to the entrepreneur or not to the company side, you go to the dark side. And it's not like this anymore. So it does like this, So, and it seems that the scientists, if you move there, obviously you are not the best. I'm not the best finance at all, and I have a CFO in the team for sure from the minute one. Okay, but probably as peptide science, we have had this privilege of collaborating with people very different from us, biologists, informatics, this. So in fact, when you are in the company, you are doing the same, collaborating with people that is completely different from you, the CFO, this, that. So this ability, I think it's in the genes of the scientist. Mm-hmm. And it's the only thing is that you move it somewhere else. That's it. And I think that's why day after day there are more people that it's feeling comfortable to do the role of CEO.
Yeah. Absolutely.
And a lot of women. I don't know in the States, but in Barcelona there are a lot of women.
This is what I was going to go to next, was that I love seeing that. And even when I looked at your website, I saw the 2 C-level suites were women, and it's so great to see this, coming to fruition. It's taking a long time, but it's happening, and then another barrier that you are breaking.
Yeah, yes, it's another barrier. So it needs a lot of training. It needs a lot of training of the woman entrepreneur. You need training because we are. Sometimes we think in a different manner, and when we ask for investment, I always made the same joke. We start saying, yes, I need 6 million, maybe with 2.5 will be enough. It's like, what? How much do you need? 6, 4, or 2.5? So you need not to do a domestic economy. Like you need to say, yes, I need 4, and if I have 6, I will be able to do that. No, but we start to do these strange things, and I think that this can be perfectly cross it or whatever with someone that will teach you how to be a CEO. And I think that sometimes the women CEOs, we need this coaching or this.
Sure. Yeah.
This network could be a network but these trainings of.
Yes. It might be nice actually just to do something, even just our own virtual workshop with CEOs, and talk about this to, like you said, sort of you get it out in the open and have people think about it, that it is something that sometimes if you just bring something to the consciousness of scientists, that they can go like, oh yeah, I do that. I shouldn't do that.
Because so as scientists, I love facts, numbers of that.
Right.
So there are some facts that exist that are companies directed by women. Sometimes we get less funding overall. Yep. Mm-hmm. This is a fact. You put the numbers.
Yes.
But the only thing is that the reasoning why I think it's duty of all the partners or all the actors around that, and the women that we are asking for the money. I think that we also need to learn. It's not only that the investor need to invest more in women, which I don't think that they make any difference. Is that we maybe don't ask for the right moment or the right amount of money, or we don't feel comfortable with that, and we need to learn that. And because after that, the another fact is that it's known that, and the investors know that when you have the money, we are really good at dealing with that, negotiating. So this second part goes very well, but not in the moment of negotiation of the salaries, and it's the same, the negotiation of the investments or these things. We are a bit more, we need to be trained a bit more, I would say.
Yeah. All right, another call to action. You need some training in business interactions, having a certain mentality. You know, I've seen a lot. I mean, just I think with scientists in general, because I work a lot with students, and what I see is again another barrier to communicating value, that one doesn't want to come across as egotistical or arrogant. So then but then it's hard to say why you're the best person for the job. And I think that's also part of what you're talking about. I need 6 million because these are the things that will be done with it.
Yeah.
Like, and I will get those things done with 6 million, not like, oh,
no.
no, I know I'm not that great, but if I like do extra work, I can do it with 2. Like, I see what you're saying.
No.
It does. It's almost like a value proposition that it comes down to. And I hope that scientists can get more comfortable talking about their value.
Yes.
Yeah.
Because I think that many of the skills required, we have them. The only thing is that we don't know how to sell them, how to explain them.
Yes. And I think this is, also something to think about when, we train scientists really well to do science, right? They get your PhDs, you know how to do science, but then you're thrown into a manager role and you've never had a course in how to manage people or how to be a leader. Yeah. And similarly to your point of how do you negotiate in business? Maybe these are things that we should think about. If not adding into the curriculum at universities, at least adding into conferences and other opportunities for students to engage with folks.
Yeah.
So, yeah, and I do see, I think, conferences getting more interested in this.
Yes, but if I think about the 10 PhD students I have co-direct at IRB, so they have end up in very different places. So ranging from being PI or professor in university in Iran back, perfect, to be a patent attorney, great. It's something that I don't love, but it's great to have a friend there. And then for example, Bernard decided to be, and he's the chemist in one of the best restaurants in Europe.
That sounds like fun.
Yeah, it's so. But I always make joke. But what do you have for dinner? He's like, no, I'm not preparing the dinners. I'm creating new methods in cooking in one of these top. When it's one of the best restaurants in the world. So it's for your way of thinking, not for peptides. I did. You're preparing peptides. No, I'm not preparing peptides.
Right. It does.
It's the way of thinking.
It is, and you're right. You're trained, no matter what you're trained to do science, and it can be across any area. But it always does break my heart just a little bit when I hear someone's not working on peptides after they've been trained as a peptide scientist.
No, we had a plan, but we didn't do it because of the pandemic. He was like, "Oh, I will design a dessert that will be like solid phase." Like then you will have the first flavor. I remember making jokes like, "No, it's not possible in a restaurant." But this kind of level of creating new methods. So it was more similar to science, maybe not to peptide science, but to science, not to cooking for cooking.
Yes. That sounds like a really, really fun career. Yeah.
But it's true. I think that the peptide science opens you the door to be in a very wide kind of career at the PhD.
Right. Absolutely.
But we need to do training to feel comfortable, and that people show the values, the value proposition. You have learned many things, not only your peptide on your PhD.
Yeah, absolutely. Yeah. So something else, just that I'm curious about. I guess you're obviously developing new skills because we already talked about the business skills and learning that, but also something you mentioned before that I've talked to other entrepreneurs about is this issue of scalability. Because this is a business argument, but then it has a scientific foundation. So can you talk to me a little bit about how that's played into your negotiations and just also your, I guess, new knowledge in that area?
Yeah. So a scale up it's at all levels, no? For me, it's a scale up of the product. No, we are manufacturing our car and caravan, our first product in grams. So the first time I saw 10 grams of my product, I was like almost crying, like 10 grams? I've never seen together 10 grams. The maximum amount I have ever seen it was 25 milligrams of something like that, no? And also doing it in a manufacturing environment. So it was a completely different thing. And that was, for me, it was the first no-go as a peptide science. So if after 1 year we are still fighting to have 23 milligrams, then there's no project. So this is kind of the scale up of the things, no? When you jump to the company. Also, the scale up of the or scaling all the other actors or interactions that you have, no? Interaction with investors, interaction with the partners, interaction with the lawyers, interaction with like all the other things that are. So your universe of interactions is expanding a lot. Sometimes you only devote less and less times to the lab, no? It's part of the process, I think, no? It also happens when you are in academia, no? When you start to have more PhDs, then you have more teaching them that not doing you the experiments, so it's a natural transition, no? But then it expands, and then you have all those other things, but it's enriching. And also expanding to learning something that it's closer to the reality at the end, no? For the maximal closer to the end user I have ever been before was when I moved to the cells, which I don't know if they are much closer to the final user. Probably yes. Now sometimes we reach mice, no? But now we are doing the experiments in animal models that are derived from patients. This is closer, so it's getting closer, no? And this is, it's not a scalability, but it's we are moving, and it's nice. It means being out of my comfort area many days, but I love to be sufficiently out of your comfort areas. I think is where you learn a lot.
Yes, absolutely. Yeah, I think that the point you're making about getting closer to patients is also a really interesting space to be in. Because like you said, there's something about like, I'm making this for that person, or like I'm actually seeing, working with physicians and really understanding, like, what were you going to say?
The more closer to the patients you are, the more modest you need to be about your findings. Now, when you are only at the lab and the maximal goal you are seeing is to publish in an article, it's not that you are overselling, but you can explain things in this is what I have found and the potential is that. When the more close you are to the patients, you need to be always with 1 foot on the earth, explaining where we are. This can still fail for many, many reasons. Normally you don't explain, yes, this can still fail for many, many reasons, but the closer you are to the end, the more that you need to be realistic, no? And I try to go to the hospital because the hospital is where we are collaborating, is close to our office. And I spend there all the Fridays to be close to the reality.
Wow.
To be close to the reality. And we have an office there also, and then, this is the reality.
Yes. Wow, that's amazing.
No, and it's not a publication, it's the reality. No,
Right.
And for example, if you ask the kids what they want, we have not asked, but they want to do it at home.
Oh,
they want to do it at home.
Yeah.
Probably if you ask their parents, they want to get cured, but the kids say, I want to do it at home.
Yeah.
And then there are two options: to do the treatment orally, which is very difficult, or the other approach, that it's the one that it's being done here in Barcelona, is that the hospital resembles more home.
Oh, okay.
No, it's the other option.
Yeah.
No, but you know, from your customer, you find what they want, and then try to adapt the solution. The obviously is, you do it at home because we have been developing it for oral, but it's a jump of difficulty in our case. But the other is like, then means that, for example, in the pediatric cancer center, they will open it next year. Instead of rooms, they have like apartments.
Oh, that is so nice.
Because it's closer to home.
Yeah,
right?
Absolutely.
This is your home for a while.
Right.
So, and I like to have these inputs from not from the end user that is now sick, but from this is the reality. Right. That the doctor, when he will prescribe our drug, this is the reality that they have to explain the families.
Yeah.
And yes, it's part of our duty.
Yes, absolutely. And I think it's really phenomenal that you're, number one, going to the hospital every Friday to really have an understanding of the patients. And I love your point that, just because something on a molecular level works does not mean that when you transition that into a real world scenario, it will work. And of course, this is why we have to do clinical trials.
And if not, everything will be cured.
Yes.
You know, like.
Yes. Yeah. But to your other point, that also I think looking at disease as a holistic, and this goes back to your empathetic nature, that disease is not just a series of molecular interactions, it's emotions, it's family, it's the people working on the projects, it's everything. And so I think that you're getting this really great experience that you can really communicate with the world.
It's tough and
yeah.
No, but it's a great experience. Okay, it doesn't mean that every day is perfect and everything is easy. Doesn't mean that.
Right.
But you try to find why you every day, or as an entrepreneur, you try to solve all the ups and downs of like, okay, yes, we do it for that. Keep going. No, you have your ups. I would say, as a CEO, one of your roles is to make that the ups are really high and the downs are not so low. Try to make. Try to do it.
The role of CEO is to normalize the ups and downs,
especially the downs. The ups, okay, it's not a problem.
Sure. Yeah.
No, I have learned that, and I have learned one other thing as a CEO that you need to do is you receive certain pressure.
Mm-hmm.
Let's put it 100.
Yeah.
From this pressure, you pass part of that pressure to your team, obviously. Because if not, it will not be fair. So you don't know, everything is perfect. There are no pressure. So this is not reality. So one of your duties is to pass part of that pressure to your team. But the art or the difficulty is to pass the right amount of pressure.
Yeah.
No, because there's one pressure that you need. So it's not fair also to pass from 100 to pass 100 or 120. No, 120 is not possible. Or even 50. But so there's one part of the pressure that you keep for you, you organize yourself, but there's one part that you pass to your team, explain, guys, this is the situation. Okay, and it's almost like an art, okay, you need to find,
yes,
because if not, they live in Disney World, and it's not Disney World, you need to explain.
Yeah, and Disney World's not the most motivating either, right? Scientists do science because we like challenges, right? We want to figure something out. We don't want to live in la la land. So yeah,
it's good.
Incredible. Well, I have one more question, and then I'll sort of open it up to you because I'm sure there's things that I've left out. But I'm curious, looking at the map behind you, knowing that you're going to Thailand with your kiddos pretty soon here for vacation. What's sort of the most intriguing area that you hope to visit?
So we are discovering another part of the Prisma. So I'm a scientist, I'm the special mom of a special kid, and I love traveling. So I have been in more than 50 countries around the world. I cannot hear you.
I was just saying, wow. You said 50, 50, right?
50, yeah. 50.
That's
50. So I have my first passport when I was 2, and I was traveling all around the world with my papas.
Yeah.
So I love it. And during many years, all the summers, we were traveling for 2 or 3 months. So it's part of, I love it. So I find that this summer is the right moment. I have traveled with Mark. He's 13 now. I have traveled when he was a baby or young. But now it's like, okay, now it's the moment you start to be like a teenager. And
carry your backpack.
Here's your backpack. Yeah, but the secret, and I because we are like a small family, the peptide side, we are like a small family, that Mark goes on a wheelchair. So he's user of a wheelchair. So it will be a great adventure as a family to travel around Thailand, especially the north of Thailand. We are traveling, especially traveling there with the wheelchair and Mark and the rest of the boys. So it will be great adventure. It's breaking barriers. So it's going beyond barriers, knowing or visiting the world through the eyes of Mark, it's great because he make that people, it's in a uncomfortable area, no? So normally he asks people, oh, are we going to go walking or by car? And then people start like, He has said walking. Yes, obviously he will not say on a wheelchair. So for him, wheelchair is like walking.
Right.
So he normally says, yes, let's go walking. And like, walking? It's really like on a shock. But it's part of the fun. It's something you don't choose. It's what, you don't choose that things, but I think normally you need to learn to play with the cars that you get. And so we will enjoy a lot Thailand this summer. We have been preparing it for a while. During the pandemic, was like, okay, when this finish, we will go to Thailand. Great.
Yes. That's one of the places on my list is Thailand. I really want to go to Thailand. But I think that it's such a good point that you're going to have an open experience because you have to address where's the accessibility, what are the best places to go, and how do we get there? And you're going to find new things that other people wouldn't see.
Obviously, there are things. So if you are a tourist that you go with the list, exactly the 5 things that you want to see, probably there are 2 of them that are not completely adapted to reach those with a wheelchair.
Right.
There will be a no in the list. But if this is the experience of traveling around Thailand, then the experience for sure is 100%. And from these 50 countries I have traveled, the best things I remember always are the anecdotes, not the picture on that icon place. It's more the things that, you remember when we were. So these are the ones that you really have fun.
Definitely.
And traveling with a wheelchair, I promise you, is fun for sure. Many times it's fun for sure.
Right. That's so exciting. Well, is there anything that I didn't ask that you wanted folks to know about Gate2Brain or any of the things?
It's perfect.
Okay.
Yeah.
That's great.
I think it's nice, the idea of creating these not satellite meetings, because it's satellite sessions or encrypted sessions. Because if you make a satellite the day before, people doesn't come to the meeting. But sessions in the middle or the free afternoon. In fact, in Barcelona, we are organizing like the miscellaneous morning.
Okay.
For these things, that morning is the morning to learn about other things.
That's awesome.
And in your career. So I think that's one of the evolutions of the meetings, which I think it's interesting.
Yes, absolutely. I think, I'm so excited to see how all these new engagements turn out.
We'll see.
And like you said, it's, being that in person and getting that missing ingredient.
We'll see. I'm sure we will have fun. We will learn. It's obviously that everything that you present on a meeting, sometimes or before or in a soon future, you can find it on the journal published.
Yes.
But it's the collaborations, it's the rest of connections, interactions are the ones that make the difference.
Yes, absolutely.
Are the ones.
Yes.
It's are the ones that make the collaboration, that make the science make a jump for the next work that will be published. No, these jumps are the ones that are when you collaborate with people, and you cannot put. It's like in Whistler. You cannot have 400, 500, whatever, for 1 week in one place. Scientists, I'm sure they start to think about how to collaborate. They cannot do anything else. I'm sure.
Exactly. I feel like
they cannot avoid it. They cannot avoid it.
I totally agree. You get more than one scientist in a room and some collaboration will happen. It's just, like you said, it's our nature. You do this. Oh, I do this. We could do that.
That's it. It's perfect. It's great.
Yes, absolutely. So, all right.
Thanks, Wendy, for this wonderful series of podcasts. I'm sure that you have contributed to the peptide science family with your work these years. And that is part of that.
Yeah, thanks. I love it. Thank you for your time. Like I said, I know it's busy and I really appreciate it. Thank you for tuning in to this episode of Exploration Science. If you enjoyed this content, please like and share with your communities. As always, we appreciate your feedback as well as your suggestions for topics that you would like to see covered. Thanks again for tuning in.